So one of our recent FOIA requests to the Canadian government, in this particular case, Health Canada, has returned a result. The request was focused on how many deaths occurred in Canada of just COVID-19, where COVID-19 was the only thing listed on the death certificate. And I'll talk about why I think that it does have some importance, but also can be misinterpreted as a statistic. We basically were requesting, does Canada know the answer to this? Now, just to be clear off the hop, there's different ways this information could be calculated. It could be done at a provincial level, and then it could also be done at a federal level, which is one of the areas that we did FOIA. There's within that there's Health Canada, and then there's also the Public Health Agency of Canada. So I've FOIA'd the province of Ontario, the Public Health Agency of Canada, as well as Health Canada. I'm waiting on responses from both Ontario and the Public Health Agency of Canada. What we have here today is Health Canada. We're going to break down why that's important. But simply, their response after about 35 days or so was, having completed a thorough search, we regret to inform you that we were unable to locate any records responsive to your request, as Health Canada does not track this information. You may wish to file your request with the individual provinces and territories. So as mentioned, we did go to the province. We started with Ontario, we went to the province. They have requested a 30-day extension. So, in terms of hearing back from a province of about, 15, 16 million people, which would be interesting to see some of that data, we're gonna find out what that data looks like probably in another 30 days. We're assuming we're gonna get something from them and they're not just gonna come back and saying, hey, we asked for an extension, but we didn't actually get anything. We think we're actually gonna get something, but what Health Canada is saying here that we don't have anything. Of course, we're waiting for the Public Health Agency of Canada as well. The reason why I thought at a federal level this would be meaningful is because if we're talking about these agencies, Health Canada, the Public Health Agency of Canada, who are both involved, right? If you look at a lot of the data throughout government websites, they're both involved in aggregating data, in sending a clear picture out to Canadians with regards to COVID, with regards to preparedness, what they can do. We're talking a lot about vaccine tallying and vaccine numbers. They're providing epidemiological rundowns of what's happening in Canada, how many cases, how many hospitalizations, how many deaths, how many, all these different details are being aggregated by these two federal departments. Now, it's not clear which one would be responsible for the request, which is how many people only died of COVID. Perhaps that would have to be given by the provinces up to the federal level, and then the federal level would aggregate that data. Now, my thing is this. If we have federal mandates, for example, here in Canada, that are essentially saying, people that are unvaccinated cannot travel, right? You're not allowed to do anything if you're vaccinated. And we sort of have this culture that has sort of started at the federal level and sort of dripped down into the provinces. And that culture says, there's essentially a one-size-fits-all when it comes to COVID vaccination. Everybody should be vaccinated. What Justin Trudeau is saying is every single Canadian needs to be vaccinated. It's our best way to protect against this pandemic. When this type of rhetoric and stuff is going on over and over again, you would assume that it's being informed by data that is really important, in making that decision. Meaning, if you're gonna have a one-size-fits-all, when you have a vaccination when you understand that the vaccine does not stop transmission, it does not stop infection, it only mildly reduces, severe disease for a period of time, and then it becomes unclear exactly what's happening. And then boosters, of course, they don't give you protection for that much longer. What you're dealing with is a vaccination that is really no more than a medical treatment. So now you got to decide, well, who should get that medical treatment? If we're not going to stop transmission, we're not going to stop infection, who needs that treatment? And of course, what we do know with data here in Canada, and we've known this around the world, and we've known this for quite a while, is that people that have multiple comorbidities are significantly at greater risk. And in fact, it's to the point where there are certain groups of people of certain ages and of certain, comorbidity factors where their risk of COVID and risk of severe disease ending up in hospital is significantly greater than people in younger age groups or who have no comorbidities at all. Remember that across the board, the rate of people ending up in hospital, unvaccinated included, is less than 1%. So you're talking about a disease that's not deeply impacting people across the board. It's impacting certain subsets of people. So when you're turning around and you're making policy, and you don't even know, hey, for someone who's healthy, who does not have a comorbidity, who is not, of a certain age group, when you're saying you still need to be vaccinated, which means these people are assuming risk associated with this medical intervention, which there's been safety signals all over the place with regards to vaccination and the potential challenges with it. When you're saying that you don't even have data to support the severity of this disease when it comes to people with no comorbidities, it means you're making an uninformed decision, and one that now that you're mandating that regardless of all the information we have, it makes it so that people have a reason to say, how could you possibly make this type of policy at the federal level? How could you tell everybody who's unvaccinated, regardless of how ill you are, regardless of how many comorbidities you have, regardless of your age, treat everybody the same way? And now we know too, on top of that, and I'll kind of flash a couple of studies here, but there have been multiple studies going out that are further proving the safety signals, especially in younger cohorts, people under 30 years old who are generally healthy, that these vaccines may be actually causing more problems than COVID could have itself. So again, you're pushing people to accept risk they do not need to accept because they do not need to be vaccinated, right? Most of the narratives that we've been told are not true with regards to, hey, well, this vaccine is just going to end the pandemic. We know that that's not going to be the case. We know that's not going to happen. So what I wanted to do with this FOIA exercise specifically, and it's still ongoing, this effort is still going to require us more time to work with the Public Health Agency of Canada to aggregate the data that's going to ultimately come out of Ontario in the coming days, is I just wanted to show an exercise of transparently what data was the government operating off of in making these decisions. Because there's so many different ways to look at this stuff. And when we're seeing this heavy-handed, blanketed approach, where people who are questioning this approach are being called misogynistic or racist or extremists or Nazis or whatever it might be, it typically means that something is wrong in the overall collective sense-making and the overall decisions that are being made at a governmental level. And I think it's important as citizens that we understand and find ways to communicate with one another about this in a much more meaningful way. And, unfortunately, having to go outside and get the transparency from the government because they're not going to give it to us willingly is essentially what we need to do. So that's the update we have at this point. Look out for some more updates on this because we're going to continue to gather this data. Remember, in the UK, some of this data for England and Wales existed, and we saw that the numbers of people that died of just COVID were very, very, very small. Now, that doesn't mean COVID wasn't involved in other deaths. It may have been, but the general point is that this gives us more clarity as to why mandates and these heavy-handed approaches don't make any sense for the entire population, and how it's actually potentially dangerous to be giving out these wide-spreading mandates of a treatment for healthy people that really don't need to be protected this deeply against this disease. So if you want to continue to support our FOIA work, I mean, we're doing freedom of information requests in a number of different areas. It can get costly. It takes a lot of time. It takes a lot of energy and a lot of research to do it. Please, please, please support us in the donate link below. That will go directly towards supporting this type of work, or also become a member, where not only do we talk about do you get access to this type of content, but then we get into groups. We talk about this type of content. We try and make sense of things a little bit further. And a number of other things that we do inside our membership, which you can learn more about by clicking the button and looking to join to become a member. But that's what we got so far. Thanks so much for tuning in. As always, subscribe and share this with other people. Remember, there's lots of different ways we got to look at thinking about this stuff if we want to understand why there are so many people feeling like there's problems with what's been going on with this pandemic. And it's important to ask these questions because the severity of decisions, how impactful these decisions have been on people, their lives, their livelihood, what things are going to look like in the future, surveillance, grabbing of more power. It's really important that we consider this stuff and talk about it in a grounded and meaningful way that leads us towards meaningful action.